This is Dr. Jerry Hesch from the Hesch Institute in Aurora, Colorado. And this is my client Mark, and we've already had a couple of films on him on his cuboid syndrome and also on his sacral torsion. And this film is on the upper cervical spine. And for the last 6 years, he has had his atlas adjusted by a chiropractor about 4 or 5 times a year. And I want to demonstrate that his upper cervical spine is hyperextended. When I come on top of the mastoid on both sides and I try and spring it posteriorly, there's no give. When I come underneath the mastoid and I try and side bend it, there's no give. And when I come on each side of C1, I'm on the transverse process of C1, and I try and shear it left and try and shear it right, there's just no give. When I come down to C2, boom, we have good mobility, excellent mobility. When I put my finger underneath C3, I can lift up, and when I put it on C2, I can get some upward mobility, and I flex him a little bit so I can expose C1, and I try and lift C1 up, and that's where it gets very tight. His head is very heavy if I try and get movement through the first joint, but if I come in, I capture C2, then I can create movement very freely at C2, C3, and below. When I try and traction his upper cervical, I have to have contact on this part of his head because I want to capture occiput C1 and C1, C2. All the other joints are more posterior. So for mid and lower cervical, I would have a different contact. But to isolate upper cervical, this part, the palm of my hand, is basically on his temples. And so when I try and create traction, it feels like I'm trying to pull a block of granite. There's no movement, there's no give throughout his body with a reasonable, typical amount of force. And that's also true when I have him in extension. Try the same maneuver, and there's just no give. Now when I bring his head into 10 to 15 degrees of flexion, then I get a little bit of mobility. I can see his feet bob up and down. So the force is translating downward. So that's going to be the treatment position. I'm going to treat him with traction applied to the upper cervical spine in flexion. And I'm going to maintain that for 5 minutes. And then I will refilm his response to treatment.